Hey, it's Dr. Adam Sewell, MD, and welcome to section 3.2 of the Microplastics Toxicity training. In the previous section, we explored how microplastics enter the human body through ingestion, inhalation, and dermal absorption. Now we shift our focus to what happens next. Where do these particles go and how do they behave once inside? This is where things become even more clinically significant. Microplastics that cross the body's protective barriers, whether intestinal, respiratory, or cutaneous, don't just circulate passively. They can accumulate in organs, lodge in tissue, activate immune responses, and persist for years. This section is about tracing that internal journey and understanding how it contributes to the chronic symptoms we're seeing in clinical practice. Part 1. The journey through the body, lymph and blood transport. Let's begin with how microplastics travel once absorbed. After crossing the intestinal epithelium or alveolar membrane, microplastic particles can enter the lymphatic system or the systemic circulation. Particles absorbed from the GI tract often travel through Peyer's patches and associated lymphoid tissues. From there, they drain via the thoracic duct into the bloodstream. Those absorbed through the lungs enter directly into pulmonary capillaries, bypassing first-pass metabolism. Once in the bloodstream, particle behavior is influenced by surface charge, shape, and polymer type. Studies suggest they can bind to serum proteins, interact with immune cells, or be taken up by circulating phagocytes. A 2022 study led by Leslie et al. In Environment International demonstrated for the first time the presence of microplastic polymers in human blood. Among the 22 healthy volunteers tested, 77% had detectable levels of PET, PS, and PMMA, clearly indicating systemic circulation. Part 2. Where do they go? Organ accumulation patterns? Gastrointestinal tract. Not all particles leave the GI tract. Those that remain can embed into the mucosa, alter gut flora, and provoke immune responses. The result? Symptoms resembling IBS, chronic bloating, or even inflammatory bowel diseases. Liver and kidneys. The liver is a central filter for bloodborne particles. In 2017, Dung et al. Published a key animal study in Environmental Science and Technology demonstrating hepatic accumulation of microplastics. They observed oxidative stress, disrupted lipid metabolism, and signs of hepatocellular injury. Nanoplastics have also been shown to impact renal tubules, impairing filtration and promoting localized inflammation. Lungs. Microplastics inhaled into the respiratory tract can evade mucociliary clearance and deposit in alveolar sacs. A 2022 study in Science of the Total Environment confirmed the presence of polyethylene and polystyrene particles embedded in human lung biopsies. The concern here is long-term retention and fibrotic remodeling, especially in patients with pre-existing pulmonary conditions. Placenta and fetal exposure. In a landmark study by Ragusa et al., published in Environment International 2021, microplastic particles were detected in human placental tissue, including both maternal and fetal sides. This suggests that transplacental passage is possible, raising red flags about fetal development during pregnancy. Breast tissue and lymph nodes. Emerging evidence suggests that microplastics preferentially accumulate in adipose-rich tissue and regional lymph nodes. Their hydrophobic nature facilitates migration into fat stores, potentially interfering with estrogen metabolism, leptin signaling, and local immune surveillance. Part 3. How do they stay there? Persistence and bioaccumulation. Unlike organic toxins or heavy metals, microplastics are not metabolized. They are biologically persistent. The smaller the particle, the deeper it can penetrate, and the more likely it is to evade clearance. Particles taken up by macrophages, dendritic cells, or epithelial tissues may remain intracellularly sequestered. Some studies have shown granuloma-like foreign body responses, including multinucleated giant cells and chronic cytokine release. This can result in fibrosis, tissue dysfunction, in some models precancerous changes due to chronic oxidative stress. The term bioaccumulation becomes crucial. Each exposure event via water, food, or air can contribute to total body burden. And unlike lead or mercury, we don't have reliable chelation strategies or excretion pathways for synthetic polymers. Part 4. Limitations in detection and clinical implications. Clinically, this is a diagnostic blind spot. There is no standardized, non-invasive method to assess microplastic burden in living patients. Current tools like Raman spectroscopy or Fourier transform infrared (FTIR) microscopy are restricted to research labs and tissue biopsies. So how do we proceed in practice? We focus on symptom clusters, unexplained fatigue, systemic inflammation, dysregulated hormones, and exposure history. Use the MHA exposure checklist and MTI index as a framework. While we wait for better diagnostics, we use a risk-based model, like we do with mold, endocrine disruptors, or environmental metals. More funding, interdisciplinary collaboration, and clinical awareness are urgently needed. To recap, microplastics, once inside the body, can travel through lymph and blood, accumulate in vital organs, and remain there long-term, triggering a cascade of inflammatory, fibrotic, and possibly neoplastic responses. This is not fringe science. It's a growing clinical reality. Our patients may not know it yet, but their fatigue, their gut dysfunction, their hormonal instability might all be part of a larger toxicological picture. In the next section, Module 3.3, we'll explore the immune consequences of microplastic accumulation. How do these particles interact with innate and adaptive immune systems? How do they contribute to chronic low-grade inflammation, autoimmunity, and even disruption of the gut-brain axis? Stay with me. We're building a model of clinical relevance from the molecular to the systemic. I'll see you in section 3.3, Immunological and Inflammatory Impact.